it is when you're treating the human body, every human body is different, is unique. Though structurally, anatomically, the structure may be the same, but the metabolic response, the drug response to various treatments, every human body is a jiva, is a soul embodied, a divine soul embodied in a physical structure. So when you are dealing with human lives, it says the most complex machine on earth is the human body. So you are dealing with that machine, that divine creation. It entails necessarily a high degree of sensitivity, empathy, skill sets, yes, of course, knowledge, competence, but compassion largely. So these attributes are very, very crucial and critical in the in the in the entire medical career. So I would like to say that when you are embarking on your medical journey, listen to doctors, listen to good experiences, watch fiction serials, medical operas like Doctor House is there. We have Grey's Anatomy, so on and so forth. So anyway, so this is in brief the spirit of the medical curriculum, and I would like to take you through the journey for the first prof, second prof, third prof, and in this session, of course, we are unraveling the basic spirit of it all. In internship, you are having your circulation in various departments where there's a month long in internal medicine, one month long in surgery, in pediatrics, and obs-gynae. So 12 months internship is divided into various departments. Then you also go into certain elective, certain additional departments like radiology, anesthesiology, and even for that matter, you see some onco departments also. And because AIMS being a tertiary care hospital, you get the exposure to the DM level of departments in terms of your internship, and there is no limit to learning. I mean, our professors at AIMS never barred us that if you have completed your stipulated hours of ward rounds, that if you cannot do more, you can always do more. And if you're staying in the campus, why not make the best utilization of this? In fact, I would like to really quote here that during my gynecological posting in the internship, I studied 32 deliveries in the labor room. I attended these deliveries, I learned so much, actively participated. So every posting, every subject, you're learning the theory, you are doing the labs, you're doing the ward rounds, then you're coming back to your textbooks, you're seeing patients, in the internship also, through live cases. So all that correlational, how the brain wiring which goes in the mind, in the brain, it leads to a lot of deep knowledge. And that knowledge has not to be limited to just question papers and examinations.
Dr. Surbi, with your permission, I would really like to just come in for a moment that while Dr. Surbi is talking and eulogizing the entire institution of All India Institute of Medical Sciences, and thanks to Madam Sushma Swaraj, who, while being the health minister during the Atal Bihari Vajpayee Sarkar, thought of expanding the AIMS network. Now we have such a sprawling network of 23 odd AIMS, almost one in every state of the country. And still the challenge of intertwining the AIMS pedagogy down to the state level, the federal challenges are still existing. But I would really like to say that once we hear it all, you should, in whatever medical college you are, this adoption of the AIMS pedagogy can always be done by the students and the faculty and the management combined. And the entire purpose behind is not to create a kind of caste system or a class system out here. But
Yes.
somewhere like if an institution has really since 1956 onwards and counting, if this institution has really set out some of the futuristic frontiers and globally best medicos across specialties, it's one of the most, I would say, even the IITs don't enjoy such a close knit community what these Amazonians have. Because the kind of relationship we have to, I think these learnings should be taken up with humility. In whatever medical college we are, Dr. Surbi's tips and tricks are largely to help you to make the most of an MBBS program.